Now, the Ministry of Health is on the spot yet again over COVID-19 billions. The Auditor General is raising questions on how COVID money was used during the pandemic.
In the report, the Auditor General questions how some 10 billion shillings meant for the purchase of COVID-19 vaccines was spent to acquire 1.5 million vaccines only, and why ventilators paid for using taxpayer money were left uncollected to date. The story was produced by Brenda Wanga.
The country is in the grip of another wave of the COVID-19 pandemic, with the positivity rate steadily climbing over the last few weeks to now stand at 9.6%. But even as the efforts to contain the spread and vaccinate more Kenyans continue, questions abound on just how the monies disbursed to fight the pandemic since its landing on Kenyan soil have been used. The audit findings show how huge sums of money remain unaccounted for. And as the government continues to push for mass vaccination of the people, the Auditor General has turned her attention to the acquisition of the vaccines. The report finds that the Ministry of Health had an agreement to procure 10 million doses of the Johnson & Johnson vaccine at the cost of 10.96 billion shillings. The budgetary approval for the same acquisition was set at 7.6 billion, meaning there was an overcommitment of 3.3 billion shillings. Out of the 10 million vaccines ordered, only 1.55 million had been delivered to Kenya by the end of last year, raising questions where the rest of the funds went or the whereabouts of the paid vaccines. The report also shows that the Ministry of Health used 300 million shillings to procure Gavi vaccines. The red flag here, according to the auditor, is the fact that this expenditure was not approved by the National Treasury, making it difficult to establish if the expenditure was done procedurally. But perhaps more puzzling is the criteria used to award tenders to suppliers of masks to the ministry. With a budget of 16.45 million shillings, the ministry was to procure masks under the Transforming Health Systems for Universal Care project. Kemsa was tasked to pay suppliers of the masks. Although the specifications for the masks were the same, one supplier was paid 250 shillings per piece, while paying 700 per piece for the exact same masks to 3 other suppliers, an exaggerated price that the auditor wants answers to. Where the country grappled with hospital equipment for the treatment and management of the COVID-19 patients at the height of the pandemic, 13 out of 20 ventilators purchased at the cost of 59 million shillings, with each costing 2.9 million shillings, remained undistributed at the Kemsa stores, raising suspicion as to why the expensive machines were not distributed. There is also lack of clarity over how some 20 million shillings set aside for offering support to frontline workers was used. The money had been earmarked for psychological support, including cushioning the workers for 3 months, offering counseling in person and virtual for those who are directly affected by the pandemic. The Auditor General's report indicates that there is no proof that all the 47 county health workers benefited from this money. The Auditor General's office has also flagged issues to do with the accuracy of financial statements made by the ministry on spending on research, COVID-19 response, amongst others. It also shows that the ministry failed to utilize 3.1 billion shillings of the COVID money, while a further 9.7 billion shillings contained in the COVID-19 Emergency Response Fund remains untouched, a situation that is likely to have negatively affected the country's preparedness in detection and early response to the pandemic. Brenda Wanga, Citizen TV, Nairobi.